Hi, I'm Dr. Mary Jane De Souza. I am a professor in the Kinesiology and the Physiology program here at Penn State. I am the co-director of the Women's Health and Exercise Laboratory, and the kind of work that we do is focused on understanding the effects of energy status and exercise on menstrual function and bone health. The primary focus of our work is in exercising women who have amenorrhea. That is, they've stopped menstruating for several months, and we seek trials to help them recover menstrual cycles. So we just finished a 12-month randomized controlled trial in exercising women who have amenorrhea, and we help them change their energy status from a poor energy status to a healthy energy status with the goal of getting them to recover their menstrual cycle and improve bone health. Many young adult women take oral contraceptives, and if in fact oral contraceptives are detrimental to bone, we need that to be defined in the literature. There are a lot of other strategies that avoid oral ingestion because oral ingestion affects the liver. The liver then in turn gets impacted and fails to produce proper amounts of hormones that are critical to bone health. So that work absolutely needs to be addressed. There are women who are failing to understand the importance of nutrition alongside exercise training. We hope that our work will help to embrace the nutritional component that must be engaged parallel to exercise training so that women maintain healthy menstrual cycles and they maintain bone health so that poor outcomes on menstrual cycles and bone are avoided.